Real quick, I wanted to, I added this picture because it is a good representation of the adrenal glands. The adrenal glands sit right on top of the kidneys, and there are usually three arteries that supply each adrenal gland, a superior, a middle, and an inferior. So again, if they're for different reasons, if you need to do an angiogram of the adrenal glands, that is the vasculature for that. And I just thought this was a good diagram for that. The next pathologies on the list is IVC obstruction and IVC filter, which we've talked about these already a little bit. Again, an IVC obstruction is a lot of times caused by a thrombus, a blood clot, because remember, the venous system is very low pressure. It's only about 5 millimeters of mercury of pressure versus the arterial pressure is 120 over 80 as a normal. So very low flow. Blood clots are more, I would say, more of a problem or more common in the venous side because of that low flow. Now, the obstruction could also be caused by compression, like a woman who is pregnant in her last, trimester. The baby could actually be pressing on the inferior vena cava, which also could cause obstruction. But for whatever the reason, the patient presents with bilateral lower extremity edema, and these are the different things that you do to treat it. Thrombolysis, which is, using medicine to break up the clot. Thrombectomy, which is mechanical means of, breaking up the clot or actually aspirating it or literally removing the blood clot. Or, and see, now these are catheter directed, meaning the catheter is put right to the thrombus, or systemic, meaning throughout the whole body. So like these medications would be given like through a peripheral IV, like in your anacuval area or something. Elevation of the extremities and compression stockings. Then you got the IVC filter, which traps thrombi to prevent a PE. Some are permanent, some are removable. More and more are becoming removable because patients tend to live longer and they need to be removed. There is some debate about that. Sometimes they can cause DVT. Also, they could cause intimal hyperplasia, which is, that overgrowth. Sometimes they fracture and migrate and become emboli themselves. So, but then there's also times where that filter's been there so long that there's complications involved with removing the filter. So there is some debate about the IVC filter, but for the most part, so there are some permanent, some removable, and then just depending on the patient is whether they need to be removed or not. Here's a list of other common vein pathologies, and as you'll notice, a lot of them have to do with thrombosis. Remember, again, the venous system is low flow, low blood flow, so blood tends to clump together and clot more often. So a renal vein thrombosis can occur. A lot of times that is a manifestation of dehydration, and any thrombus can travel to the lungs to cause a PE. Also, obstruction of renal drainage, meaning the venous drainage, can cause renal dysfunction, again, renal failure. Varicocele, I have a picture of that. Nutcracker syndrome, I have a picture of that. Pelvic congestion, yes. Okay, sometimes, again, adrenal venous sampling. So, again, sometimes you want to remove or take a sample of the blood from the adrenal veins, and you can measure the hormone content in that. Hepatic vein thrombosis has its own name, Budd-Chiari syndrome. And then you've got the portal vein, which we're going to talk about a little bit more here in a little bit, but the portal vein can also thrombose. And then here are the veins that feed the portal vein. So all of these different veins can also thrombose. And that can cause, of course, obstruction, varices, bleeding, dysfunction of those organs. So here is an example of a varicocele, which is basically a dilated veins of the scrotum that can cause infertility. if not treated. Here's an example of the nutcracker syndrome where the left renal vein, so this vein here is gets caught or compressed between this mesenteric artery and the aorta. So to see it in a picture really demonstrates that well. Here is an example of pelvic congestion syndrome where basically the veins of the ovaries and uterus become dilated and cause pain and different things. Okay, so here we are with the portal and hepatic veins, the portal circulation. Need to spend a lot of time here because this is an area of intervention, common intervention. So you've got, again, you've got all of these veins, all of this venous blood coming from the digestive organs, and all of these veins converge or merge into the portal vein. So then this single portal vein then goes into the liver and then branches out, and all of that blood is filtered by the liver. Then that blood once again convenes or merges into the hepatic veins before going on into the inferior vena cava. Now, it's important to note that the hepatic veins are somewhat, fairly easily accessible. You can just puncture the via the jugular vein or femoral vein, put a catheter up to the hepatic vein and inject contrast. The portal vein is not so easy. It's usually, if you are wanting to visualize just the portal vein, that is a transhepatic puncture. So, meaning a needle goes, straight into the skin, through the liver tissue, and to puncture the portal vein and then inject contrast. Portal hypertension is a somewhat common pathology, which is high blood pressure here within the portal vein. Usually caused by chronic liver disease. So basically what happens is, for different reasons, this functional liver tissue gets replaced by scar tissue. And so all of that scar tissue constricts the portal vein, and so it makes the blood not flow freely into the vein, into the liver, and so causes high blood pressure in the portal vein. So causes of that are cirrhosis of the liver, which again there is the alcoholic kind, and then the non-alcoholic, which again that's one of those that just for no known reason really the liver tends to cirrhose, and then chronic hepatitis could also be another cause of that liver tissue turning into scar tissue. So complications from that happening, of course, the liver fails to filter. Also, ascites can present, and gastroesophageal varices, which are varicose veins of the gastroesophageal veins. So basically, because the blood can't get in through the portal vein, it finds alternate routes, and so these become dilated of the esophagus. One way to help diagnose portal vein hypertension is to measure a pressure gradient. So a catheter is placed down into the vena cava and pressure is measured. Then a balloon is inflated to measure the wedged portal vein pressure. And so if there is a gradient, then that can be measured that way. The normal gradient, there should be, normally there will be like a 5 millimeter gradient perhaps, but anything more than 5 indicates portal hypertension. So treatment for portal hypertension is a TIPS procedure, a transjugular intrahepatic portosystemic shunt. That is a mouthful, but if you break it down, it makes sense. Transjugular, so you're accessing the jugular vein. Intrahepatic, so within the liver tissue, there is a portosystemic shunt. So here's the portal system, here's the systemic system, and so you are creating a shunt that shunts the blood from the portal system to the systemic system. So what this is a creation of a tract through the liver between the portal and hepatic veins. Then the portal circulation can flow through this shunt to the systemic circulation, or to the hepatic vein, to the inferior vena cava. I included this picture because I liked how it showed these veins that usually should drain from the esophagus, and they're supposed to go into the portal vein, but this is a good indication, or good way, this is a good diagram that demonstrates how when this portal vein becomes obstructed, then the blood flow will find its own way, and it'll go up into these veins, and that's why esophageal varices are common. Okay, and then I included this picture because this is a good representation of the two blood, how this is a good representation of how the liver has two blood supplies. So here it's showing you that the hepatic artery brings fresh blood from the heart, and then you've got this portal vein, which is the portal circulation, that brings blood from the intestines. Also, this is a good review of the cystic duct and the biliary ducts, the right hepatic duct, left hepatic duct. That makes the common hepatic duct. Then once the cystic duct and common hepatic duct join together, then it's the common bile duct. So I just thought this was a good picture demonstrating this anatomy, and especially highlighting the fact that the liver has two blood supplies. And then I included this diagram. This is just kind of an afterthought, but I thought this was a good diagram, because most diagrams do a good job at showing the major branches. Here you've got the celiac artery, here you have the superior mesenteric, here you have the inferior mesenteric. But then, of course, you've got the renals that come off. But then this diagram is good at showing all of these other small branches that are also important. Like here you've got this number 7 is the gonadal, and and then here it's showing the phrenics and the adrenal arteries. So I just thought that was a good diagram. Oh, and here this number 13, that's that median sacral. So anyway, I just thought that was a good one, and so I decided to throw that in.